So someone asked about what really the optimal is on this. It's going to be, and that's the thing, we're seeing falsely high T4s. So repeat the T4, do the free T4 by ED, the thyroid scan, clinical signs. We really are going to treat on clinical signs. Something, clinical signs, something going on, the hypertension, if that's there, cardiac changes, something needs to be there prior to us just giving this animal iodine and whacking these thyroids. Because then you get in, if it wasn't that, then you get into a situation where the owners spent the money, they got to now do siloxane, because if you have both of them and they're normal and you treat it with iodine, you're going to kill them both. And then you get a hypothyroid animal. Associations, really interesting stuff. The hyperparathyroidism, about 70% of hyperthyroid cats have hyperparathyroidism, and they have a low ionized calcium, probably associated with bone turnover. Cobalamin and folate are actually low. So let's say you got this cat vomiting, you're not sure, you do TLI cobalamin folate comes back, it's a little bit on the low side. They believe it's a malabsorption, hypermetabolism type of thing. So it doesn't always have to be that they have intestinal disease. Prednisone, it will actually cause the T4 to lower in a euthyroid cat, but in a hyperthyroid cat it won't affect it. So if you have an animal on pred, don't worry about it. If they come back high, they're high.
Well, quick question, if the cat's on tapazole, will the folate cobalamin come back to normal if that was induced by the thyroid disease?
I don't know that. I don't know that answer. Because I don't know if it's just that or if there's other factors at play in terms of other things that are being secreted. So I don't know. My guess would be that it should normalize, but that I don't know. Sorry. Delayed glucose clearance, and that is not reversible after treatment. So they'll actually end up having, they could be a little bit high on the glucose. They have the lower fructosamine if you're trying to manage a diabetic hyperthyroid and you're looking at fructosamine levels, but you can't understand why they keep having trouble, but the fructosamine comes back in the normal. It's because their kidneys are actually getting rid of that fructosamine quickly. Proteinuria, if you have proteinuria in there and they're hyperthyroid, they actually will, that proteinuria will resolve after when they go to euthyroid, and there was no association between proteinuria, hyperthyroid cats, and then the development of renal insufficiency post. So proteinuria was just a side effect of probably the GFR, not due to underlying renal disease. All right, and then we talked about the chronic renal disease and lower T4. So is it an increase in GFR, or is it because they have chronic renal disease and euthyroid sick? So the side effects of methimazole, about 20% of cats. We all know these side effects. They have facial excoriations, white blood cell or thrombocytopenias, liver toxicity, and then the vomiting. And then the question is, on transdermal and oral tapazole, do they have the same incidence of vomiting as a side effect? True or false? So yeah, and the answer is going to be false on that. And that's really the big indication to go with the transdermal, is when the animal cannot take the oral tapazole, switch them over to the transdermal and see if they can deal with that in terms of the vomiting. All right, that was the big reason to do that. So then on the transdermal, though, when you give that, how long does it typically take for transdermal therapy to reach a steady state blood level? Is it 1 month, 2 months, 2 weeks, 1 week? So they're not, most people answered 1 month, and that is absolutely correct there. So if you're doing the transdermal and you're rechecking, you want to recheck it 1 month to see if you need to alter your dose at that point. All right? Let me go back here. So the mean 2-year survival on methimazole we talked about. Twice daily is an optimal treatment versus a lot of people do the once daily, and that just doesn't seem to work. Doesn't work as well. So the I-131, you're really looking at that perfect treatment because its iodine is selective for the overactive thyroid gland. And you've got that same study I was talking about with the 2 years, renal disease or methimazole versus the I-131 therapy. And owners should be aware of that. And I would say that if an animal has something else going on, whether it has renal disease or some type of condition where the animal's really going to have about a 2-year survival, and they're doing well on methimazole, I would stay on the methimazole. All right? But if they don't have anything else going on and the owner's saying, well, why would I do this? Because of that cost, you say, well, there's clearly an indication, there's clearly an advantage to doing the I-131 on that. Alternative treatments, sometimes, a lot of these cats that have the facial excoriations, the white blood cell, the penias, they end up saying, well, what else can we do? We can't do I-131, we can't do the methimazole. Then you can look at doing propylthiouracil. The big problem there is that there's some serious side effects to that. All right, these are life-threatening. Ipodate was something that they looked at for a while, the iodine-based, and it was effective at treating 2/3 of the cats for hyperthyroidism, but only mild. And as they treated that, it would continue to get bigger. T4 would rise. They would end up not being able to be treated with that. So that wouldn't work long-term either. This was another interesting thing in the literature, the L-carnitine. Now, they talked about not using D-carnitine because it's toxic, but the L-carnitine, it affected the thyroid, the T4 coming into the cells. So it wouldn't affect the actual T4 level, but the side effects of it, you could actually mitigate with that. So whether or not it would help for the heart or for some of the GI stuff, I haven't used it, but it was an interesting thing. For surgery, I was talking about the 3 options. It's surgery, it's methimazole, it's going to be I-131. I still say for surgery, debulk it and then treat it with I-131, because that's a whopping dose of I-131. So that's the time I would say talking about doing surgery on that. So a lot of times people call up and say, hey, what are we supposed to do here prior to getting these guys in? All right. So you've got your tapazole trial, and you're going to really begin that dose. I don't know what you all like. What we like is the 1.25 milligrams. All right, start that out. And then you increase the dose, do a 1-month recheck, and increase the dose as needed. And what we're really trying to do here is the 2 things. 1 is we're going to try and check those kidney values. And 2, if they continue to lose weight, something else is going on if they're euthyroid. That CBC CHEM UA T4, you guys do that. And then we're available if you have questions. Say, hey, I got these results. That looked good. All right. Recheck the blood work monthly. The T4 level gets within normal limits. Okay, talk about doing I-131 if you want. Stay on the methimazole if that's working for them. Monitor the renal values. Monitor the liver values. Make sure that they don't develop the white blood cell penias. Okay. When will we let them waive the tapazole trial? Because that's a big one. Owners like, do I have to go through this? Tapazole reaction, they don't have to go through this. We don't want them to have, especially on liver stuff or facial excoriations. So we can waive it. They can't pill or use the transdermal, we'll waive it. This one, the number used to be thrown out at 1035. I've seen cats with 1035 where they end up having renal disease, insufficiency afterwards. Owners aren't happy because told them that everything was okay. I haven't seen a problem when they're at 1045 or above. They seem to have enough renal function. They're not going to be clinical for renal disease. Okay? And then the last one here is a GFR study. If the owners are like, we really want to do this. We don't want to medicate our cat. We want to get them in immediately. You can actually do a GFR study. And if the GFR study comes out with a number of 2, then above 2, then their kidneys are okay for it. If it comes out below 2, they're highly likely to develop renal insufficiency. And that's a nuke med study where you look at clearance of technetium. All right, and so it's a pretty quick test, and you can look at the excretion rate of it. So after treatment, how long after reaching a euthyroid state does the GFR stabilize? And the reason this is important is you're out there on the front lines, and you got a cat that's coming in for checks on the BUN and creatinine, and the owners, they get something in their head. You know this happens. They get stuck on one little thing, and they freak out about it, and they keep worrying, is my cat going to have kidney failure? Is my cat going to have kidney failure? Is my cat going to have kidney failure? So knowing when the GFR actually goes from that 75 to 100% increase back down to what it's going to really be is good on the rechecks to say, if we reach this level and the blood work looks good, I think you're probably going to be in the clear here. So is it going to be at a month and a half? So you won't see it till the 3-month recheck? 15 days, so on the 1-month recheck you'll see it. 60 days, 2 months, so again it's a 3-month recheck, or 30 days, which is the 1 month. So kind of across the board there, and within 30 days after treatment, you're going to get a stabilization of the new GFR, which means that the BUN and creatinine are now, after 30 days, going to be where they're going to be for a while. Not to say that it isn't going to slowly get worse, as all old cats do, but that is pretty much what you're going to see. Now, with that said, if the cat goes hypothyroid, that GFR is going to continue to creep up. And if that hypothyroid state persists for over 3 to 6 months, I'm actually starting to push now to get them on siloxane, because I think hypothyroidism is just as bad for the kidneys as hyperthyroidism. It causes them to go into insufficiency pretty quickly. It really progresses disease on them. So this is once they're at a euthyroid state. If they're at a low state, and we will see them trough down after about a month, 3 months, they should come back up 4 to 6 months. If they don't, and at 6 months, start talking about reaching for siloxane. Okay? It's a lot safer drug than methimazole. So if they're low, and we let owners know that. We let them know, hey, you might have to treat afterwards. If you look at literature, it says only 5% of cats needed supplementation after I-131 therapy. I think that's BS. I think that was outward clinical signs of fat cat, greasy hair coat that was not taking into account all these other things that over time are smoldering of the low GFR, and they end up progressing renal disease. So prior to I-131 treatment, what do we do? What do we require? CBC, the CHEM, the UA, whole body radiographs. I can't tell you how many times we end up getting these rads come in and the animals have metastatic disease, something else going on. Again, it doesn't mean that we won't talk. We'll talk to the vet, we'll talk to the owner. The owner's like, we cannot treat this cat. And we say, look, your cat probably has 6 months to live. Say, I don't care. It's not a reason we won't treat them. It's just we want them to know what's going on prior to, so that they're not have any surprises. All right. Most recent lab work and radiographs must be within 6 weeks of planned start of treatment. Okay. So what do we do on our treatment package? We talk to the owners. After everything's set up with you, you guys do all the blood work. We go through the physical exam. We do the thyroid scan, and we use that to determine our treatment dosage. The cardiac ultrasound gets done because we've seen enough of these guys that are in heart failure that we turn them right away. Say, hey, you got to deal with this first. Then the treatment, and then the boarding. They're here for 5 days. The 3-day release, they're still hot. They're actually excreting iodine. It's on their pads. It's been proven it's on their pads. It's on their skin. The owners get in contact with it, and then they get exposed to it. Okay? Is the thyroid scan, is it needed for the hyperthyroid cases? You have a high T4, you have a high free T4, it's a slam dunk. We can use it to confirm hyperthyroidism, but more importantly, we use it to identify the thyroid carcinomas and for the treatment dose to predict whether or not it's going to fail. This is so true. I won't tell you that we're 100% effective, but if owners, when it doesn't work, they're always not happy with us in terms of that. So the reason I put this up is because if you don't do your thyroid scan and you do the standard 4 millicuries, or if you do your thyroid scan and do a standard 4 millicurie dosage, you're going to have about 6 to 8 cats out of every 100 fail. So you're going to have 6 to 8 unhappy owners. It's just the numbers, because that's what the levels were, and they just use a standard dose, and not one dose fits everyone. And they were looking for why the failure rate.